when I think the reverse, that should not have happened. And the current scenario is the Ministry of Education has been weighing possibilities of reopening the education sector. And the latest, as Winnie has pointed out, is that the CS or the direct, one of the top officials in the Ministry of Education has already required or requested the higher education institutions, including universities and university colleges, to plan, to map out ways of possibly reopening these institutions in September 2020. But considering the increasing rates of reported COVID-19 cases, the viability of reopening education institutions is quite uncertain, and that that means that we are not sure when the education sector will reopen. Now, of course, this affects the generation, the process, what we call in economics, the production, the education production function, where we have the process has been interfered with, and obviously there will be consequences because education is considered to have huge benefits to humanity. Now, we know that with the shutdown, there are a number of consequences. The crime rates are high, and it's unfortunate that some of the crimes are affecting our learners, and that may be a subject of discussion for my other two colleagues. So despite educational attainment in improving health, the reverse will be true if this persistent, if the COVID-19 crisis continues, and that's why it is really very difficult to understand. Now, and what we know is education in public institutions, and even for some countries, in some cases, private institutions, the government funds education for a number of reasons. It generates human capital, which is in form of knowledge, skills, and appropriate attitudes that are critical in turning around the economy. And therefore, the governments all over the world, including the government of Kenya, are motivated to support, to fund education. Now, at the moment, there are many challenges that may may reduce the effectiveness of governments in managing the education sector. At the same time, it's struggling. Governments are struggling, of course, with other stakeholders, including households who are really challenged to support the fight or the management of COVID-19. So current evidence suggests that well-targeted education-based programs can be more cost-effective than traditional the conventional way of generating or managing education. And that's why we are now talking about a turning point where institutions that may not cope with the online ways of learning and teaching may find survival very, very, very difficult. So the key thing is, at the moment, the governments all over the world, including the government of Kenya and other stakeholders, are concerned with one thing, protection of learners and the people they live with, wherever they are, and citizens in general, against the consequences of COVID-19. And that's why we are wondering the viability of the Ministry of Education proposing to reopen or urging management of those higher education institutions to reopen sometime in September. Now, the challenges of reopening, when that time comes, or the challenges of reopening education institutions soon, include one, funding. I've already hinted to that. We know how the government of Kenya and other governments all over the world are struggling to cope with many demands in many sectors: security, floods, even supplying the protection gadgets, health protection gadgets, and so on and so forth. So that health priority is important, and that's why funding for education is likely to go, to be a big problem. We know that enrollments in institutions of higher learning are increasing, and it's not clear because it's not clear how the public funding is going to be matched with increasing enrollments, even with those learners who are already registered in schools. So disruptions to instructional time in the classroom can have a severe impact on the education production function, continuity of the process to generate the required outcomes. Now, the challenges of reopening are even more serious, as we know, to those children who come from disadvantaged homes, and that is something I think one of my colleagues is going to discuss. But the fact that the country has suffered from inequalities, which have been well documented. There are reports by the Society for International Development and jointly with the Kenya National Bureau of Statistics on inequalities in Kenya, which we know is influenced by a number of factors. The most critical one is the historical factors. Some regions in this country have been marginalized, even were marginalized before, during the colonial era. And when the government of Kenya, the first national government, the first independent government of Kenya, developed a sessional policy number 10 on economic development and its applications to development. The sessional paper number 10, which is discredited, or which is known by the provision that government at the time, government of the day, that's the first independent government, will not invest in regions that have low economic potential. And that's why we have many regions in this country which have lagged behind. So education will be affected because of the lack of appropriate resources, including roads and power, electricity, even as we go online. So it's a big problem. The other one, of course, is cultural practices in some of those geographical harsh environments and so on and so forth. So it's going to be a big deal, a big challenge for the government to effectively provide education, especially in this difficult time. In some of those regions, even when we realize that we have to go online training and learning and teaching, which of course some universities have already started doing, and I'm glad that my mother university, the University of Nairobi, has even made efforts to train the lecturers, and even students are supposed to be trained on online examinations, which is the way, because blended learning, I think, might be the way forward. But again, those challenges I've said, which require infrastructures in those regions that may be having connectivity, is obviously affecting students. Now, I'm glad to share a bit of what needs to be done from the framework for reopening schools that was generated by a group of UN and other international organizations. And this is something which I think the Ministry of Education, I sent a copy of this document to the CS for Education, to the PS for Education, and I believe that some of the points that I'm going to to discuss should be taken into account, so that we don't rush doing things without taking a lot of care. So the UN Secretary General recently called on governments and donors to prioritize education for all children that we know, including the most marginalized. And the Global Education Coalition was established to support governments in strengthening distance learning and facilitating the reopening of schools. I think something which our government and government agencies and stakeholders in the education sector should follow by checking what is happening. And I'm glad that by being a member of board in the UNESCO Institute of Statistics, I'm quite well placed to receive some of this information firsthand, and I'm at the same time sharing it. So online learning and teaching is not very effective, I must say, and this is what has been arrived at by UN agencies, including UNESCO, out of the data they have collected. Now, it is at this point that I think we need to collect appropriate data on what is truly happening. I know in my college, Koitalel Samuel University College, which is the constituents college of the University of Nairobi, is making efforts to train our teachers and later on our students. There are challenges, but efforts are being made, and we are trying to see how we can move beyond just waiting for the coronavirus to go before students come in. And I'm glad to report that some of the universities in this country, which started online teaching and learning, are already way ahead of others. And this may be the turning point. I'm very sure. I don't want to imagine that what I read, a prediction in the year 2000, when I was doing my doctoral program on a document called Futuristic. It's a futuristic research magazine that predicted that in the next 25 years, which is actually currently where we may be, universities that will not cope with the changing patterns of enrollments, where a majority of learners will be part-time. And in this case, I can liken that most of our students now are part-timers because they are not on campus, are likely to shut down. And if they don't cope, that is it. So I don't want to imagine that this is the prediction that is coming through. Now, the key considerations, which before I conclude my presentation, the key concerns for consideration before reopening will be the following. One, what is the capacity of the schools and education institutions in general to maintain safe school operations, all right, to mitigate the risks? If we now know that some people in Kenya are not keeping the regulations, the guidelines that have been given, to stay safe, put on the masks. My mask is already, of course, I'm working from home, but is near here. Anytime I want to go out of the house, I'll just put on my mask. Social distancing and so on. So what is the capacity of schools to maintain or to mitigate the risks associated with the COVID-19? The second concern, so that requires a lot of facilities. We know the dormitories for boarding schools are crowded. The classrooms for normal teaching and learning are crowded, and it will be quite difficult to manage it. However, resources will have to be looked from somewhere, and that's why it's a big challenge. And I'm a member, I'm a chairman of a board of management of a secondary school in my county. Now, what is the level of exposure between the school population and the higher risk groups? All right. Before we think of reopening, we need to think about how safe are those populations where the students are now staying, and so on, the elderly and so on. The third concern will be, how does the school population travel to and from school? We know learners come from various parts of the country, and some are even foreigners. So imagine even a boarding school where learners will be traveling every day from their home to school. Before they reach school, they have interacted with the people on the roads, in public vehicles, and so on. The fourth concern will be, what are the community-related risk factors, considering epidemiological factors, public health and healthcare capacities? So these are big concerns. I know some schools which are well established have health facilities, universities and colleges have those facilities, but I think there is need to think about how to sustain those in order to ensure that learners are quite safe. I have a number of conclusions that I am making from my short presentation. That global school closures in response to the COVID-19 pandemic present an unexpected and unprecedented risk to children's education, protection, and well-being. And for the time being, the main concern is their protection and well-being, and of course their education as we plan going forward. There is need to understand the status of COVID-19 before ascertaining reopening. We know the statistics which are being read out, and I like I really admire and the boldness and the warnings that we receive from the CS for Education and the other top officials of the Ministry of Health. So it's important that EMIS, the education management systems, should be should find ways of generating accurate data and update it so that we know exactly what's going to happen. Additional sources of resources will be required for education institutions to reopen. I've already hinted to that. And I don't know where those additional resources are going to come from, because the parents are the second important source and households of funding of the education sector. But at the moment, people are struggling with the impact of COVID-19, and that is a big problem. Now, efforts are needed, extra efforts are needed to implement effective online learning in all education institutions. And I've already mentioned that requires a lot of money. There's need to buy some equipment. I wish the tablet or the one tablet per learner could be something that we should look for funding for, so that we ensure that all learners in our basic education institutions and in our universities have tablets and laptops where it's possible. Accurate, I've already mentioned, accurate and comprehensive data are required for the government of Kenya and other governments to make and implement post-COVID-19 education programs. So it's important that whatever we do is based on evidence. And finally, school reopenings must be safe and consistent with each country's overall COVID-19 health response, with all reasonable measures taken to protect students, staff, teachers, and their families, which is a big and tall order, but must be addressed. And most of those, I must say, are required before we start thinking of reopening. Thank you very much for listening.
Thank you so much, Dr. Rechi, for that presentation. Kindly remember, Martin Ogola, we are requesting that all our cameras are switched off when the presenter is making the presentation. And we really appreciate the presentation from Dr. Rechi and the elements that he has highlighted in terms of considering the school capacity, the levels of exposure, and the level of household risk, the household risk factors. And I'm sure when Kwame will be coming in to make his presentation, I'm sure this will be more highlighted, and even we will be getting figures to enable us understand when we are speaking to school capacity. How high is some of the population? So those are some of the things we'll be looking at. So we'll just move on to have our next presentation from Professor Lukoya Toli, who will be giving us a perspective from a health perspective on reopening of schools. So Prof, you will have 15 minutes, and Dr. Rechi will request that you now mute, turn off your microphone. We'll have it on during the plenary.
Thank you very much, Winnie. I would request that you put up the few slides that I shared. Yeah, thank you from the beginning. Yeah, thank you very much. And I thank Dr. Yechi for the very illuminating presentation he's made, which has covered a lot of the areas that one would have needed to cover in a presentation of this sort. So I'm going to focus a lot more on what the health implications look like when we are talking about reopening of schools in the country. And I think before I delve into the presentation, I want to agree with Dr. Rechi that I have argued before that health training institutions should never close, or should be the last institutions to close during a health emergency, for a couple of reasons. One is that health training institutions have the expertise within them to help the country to deal with a pandemic of this nature. And secondly, they have the capacity to protect the learners, and they know what needs to be done to protect learners and people at those institutions. And finally, the learners need to use the opportunity as a learning opportunity for them on how to handle a pandemic of this nature. So I agree that health training institutions should not have been among the institutions that closed in the beginning, but should have been at the forefront, advising the government and the Ministry of Health on how to handle a pandemic of this nature. But that is so much water under the bridge. The second thing that I would also say should frame this discussion is what is the philosophy of our education? Why do we take children to school? Why do we set up educational institutions? And it is the answer to that question that would guide us through emergencies, that would guide us through challenges that emerge from time to time as we continue building our education system. Are we educating our children to become better citizens? Are we educating them for practical skills? Are we educating them for global utility? Why are we setting up an education system? I do not have the answer to that. I'm sure the education experts do, but it is the answer to that question that, in my view, would advise us on whether we should reopen the schools today or whether we should wait until next year to reopen the schools. So on to my presentation. Next slide. The Kenya Medical Association has recommended 4 basic considerations before we think about reopening schools. And these include, firstly, we should reopen schools when we know the actual distribution of the disease via broad testing. So we should have some degree of testing that covers the whole country and has mapped the infection so that we know which areas are worst affected and which ones are least affected in order for us to be able to make an informed decision. The second consideration is when the risk of community transmission is diminishing or eliminated. And of course, this is dependent on the first point, that we know the distribution, we are constantly doing surveillance, and then we identify the fact that the infections are diminishing or are no longer happening in the community. And the third consideration would be when the health system is sufficiently prepared to handle any potential surge in transmission that will result from reopening. As long as the infection is in the community, reopening will result in a surge in transmission, whether we like it or not. So the health system has to be ready for that. And the final consideration that has been advised by the Kenya Medical Association is when measures have been taken to ensure that the school environment itself is safe and healthy. And Dr. Riechi has really gone into detail about what needs to be done for that to be the situation. And so I'll attempt to answer these questions in advising on whether we should reopen schools or not, or whether we should even think about reopening schools or not. So the first question as to, do we know the actual distribution? The simple answer is no, we don't. Why? Because we're doing a very low testing. Our testing rate is very low. You know, we're doing 2,000 to 3,000 tests a day. And this has been going on for more than 3 months. And there's a long time lag between testing and getting results. So making decisions, we're making decisions based on tests that were done several days ago. There's an erratic supply of reagents and test kits, which is why we are testing very few and why we have this long time lag between testing and getting the results. Our testing strategy is focused on contacts and high-risk groups, and therefore, from an epidemiological perspective, it is useful in identifying cases, but it is not very useful in, in identifying the distribution countrywide of this pandemic. And fourthly, we have political interference with very many untested strategies. Every so often, health workers and scientists are living in dread of yet another government directive emanating from a place that has absolutely no science, telling us that we have now decided to do things differently. And then we have to scramble to try and do whatever is being advised with, using as much evidence as we can and to reduce the damage as much as possible. So for instance, we've had the recent information about a COVID negative certificate that every citizen is being advised to go and get. And we can tell you from an epidemiological perspective, or even from a care perspective, that a certificate that says you do not have a certain infection is only useful as a historical marker of your risk of infection and has very little utility going forward into the future, especially for an infection of this kind. Kenyans are impatient, and all systems are impatient. Government is impatient. Everybody wants this thing to be over yesterday. Everybody wants results today. And this is something that is interfering with our ability to know the actual distribution of this pandemic. And finally, stigma. We have stigmatized this condition so much that, as the ministry was saying yesterday, that we have people we are calling the people of Corona, and so on and so forth. So this stigma will interfere with people going out to be tested, and will interfere, even if we eventually have the capacity, will interfere with our ability to actually map out this pandemic. So as far as the first question is concerned, no, we don't. The second question, is the risk of community transmission diminished or eliminated? And the simple answer to that is that no, it is not. And again, even with the limited testing that we are doing, our daily positive numbers are rapidly rising. We've entered into 3 digits. While it is fluctuating, we are seeing the possibility of reaching a place where we will be seeing 300, 400, 500 cases per day, depending on the numbers of tests that are being done. The numbers of deaths are increasing. So we are now above 120 deaths. And this every day we are reporting 2, 3, 4, 5. Another day we reported 10 deaths. So clearly there is transmission going on. People are getting severe illness and people are dying. Our hospitals have been overwhelmed by isolated asymptomatic patients. And this has necessitated the shift to home-based care to mitigate it. And this increases the risk of transmission in an uncontrolled community environment. So this is yet another consideration. There are repatriation flights of people coming in from all over the world. Every once in a while, there are flights coming in with people. And some of these travelers are doing self-quarantine because government facilities are inadequate. And of course, this carries risks of infecting immediate family members as well as people that they come into contact with. Importantly, our data collection is suboptimal. There are numerous errors right from contact information to clinical data. So we are not able to use even the data that we have collected so far to inform the response that we are designing. So this, we do not know this, and we can tell you that the risk of community transmission is still high. The next question, is the health system prepared to handle a surge in cases? Again, the simple answer is that no, it is not. And this is something that I need not belabor. We every day are seeing evidence that counties are struggling to establish those facilities that the government has decided. We need 300-bed capacity facilities in all our counties. Most counties are struggling with this because a bed is not just a bed. You need the bed, but you also need the equipment around the bed. You need staff around the bed. So we are seeing very little recruitment of health workers to prepare for the surge. And in many cases, workers are being offered very poor terms and conditions of service. Just yesterday, I saw an advertisement for the Nairobi Metropolitan Service advertising to hire a medical officer to be paid a flat rate of 100,000 shillings for 3 months, after which the contract will be over. This is not the way to build a system to deal with a surge in cases. We are going to have this for a long time. We must build for the long term. There's a reduced capacity for regular health services, and so there's increasing strain with every new COVID-19 case because people with chronic conditions like mental illness, hypertension, diabetes, cancer are having less access to services because of our focus on COVID-19, and every new case strains the system further. There's an uncertain commodity supply chain, even for personal protective equipment. While the government says we are now manufacturing locally, there are uncertainties about quality, there are uncertainties about reaching the facilities where they need to get to, and this is also straining the health system. And importantly, we do not have a vaccine or a cure, which would be the ultimate preparation for a surge. And so the health system in Kenya is not ready to handle a surge in cases. The next question, are school environments safe and healthy so that we can send our children there? And the simple answer again is that no, they are not. Under normal circumstances, our public schools and even private schools in the informal sector are not safe or healthy under normal circumstances. That we have seen children being killed by poorly constructed buildings. We have seen outbreaks of infectious diseases in our schools that have been poorly handled because of inadequate sanitation facilities, crowded classes, very few teachers and childminders, inadequate open spaces, and absent protocols for safety and health in most of our schools. So those are not there. And so under normal circumstances, our schools are not necessarily the safest places to send our children. The second thing is that when we bring in COVID-19, it places an even higher demand on the school system. And this is a demand for more space because we are saying there's going to be spacing between the children for physical distancing purposes. We are going to require more sanitary facilities, more soap, more water, more sanitizers for schools. We are going to require more staff to take care of children and ensure that they use those sanitary facilities that are available. We are going to require health services linked to schools to ensure quick action should a child fall ill and quick decision making for that matter. And therefore, the final question then is, are we therefore ready to talk about reopening schools at this time? Then we can examine this and say, in the absence of the 4 indicators that I have discussed, Are we able to put in place the requirements for safe reopening? Are we able to do that within the next month, within the next 2 months, within the next 3 months? If the answer is yes, let's do it and let's reopen schools within that prescribed period, because then there is absolutely no problem. If we're able to make sure that the health system is ready, make sure that the schools are safe and healthy, make sure we know where the infection is heading and so on, let's go ahead and do it. If not, if we are not able to put those requirements in place, and I'm convinced that we are not, we should answer another set of questions. Please, previous slide. Given that reopening of schools will mean complete reopening of the economy, remember this, that schools will be the last segments of the economy to reopen. Because once you reopen schools, it means children have to travel from one part of the country to another in order to go to school. It means that they have to have shops that are open, people are accessing markets, industry, people selling books, people selling pens, and so on. So the rest of the economy must be open and running for our schools to be operational. So if we are going to reopen the entire economy at that time, how much risk are we willing to take? Secondly, with a massive risk of increased exposure for the entire population after reopening schools and the attendant deaths, because there will be deaths, how much risk are we willing to tolerate? Now, if we have a high risk tolerance, I mean, bring it on, then let's go ahead and reopen, because even today we can do it. We put in place whatever safeguards we can put in place and then brace ourselves for the inevitable crash. It's like a plane that you know is going to crash land. You prepare yourselves the best way possible, leave everything to nature and hope for the best. But if our risk tolerance is low, then let's forget about reopening schools this year and hope that by early next year or sometime next year, we will have seen the worst of this pandemic. And so when we talk about safeguards, what kinds of safeguards are we talking about? And in my view, as Dr. Rieti has just said, our main goal in this regard should be to protect the children in order to protect the society. Because if the children are not protected and within the school environment, there is a lot of infection going on, that infection will go back home and everybody else will be exposed. And so some of the things that have been discussed before is, are we able to leverage technology? So on the plus side, it will be a huge investment that will still be yielding benefits even after COVID-19. And people talked about laptops or tablets for children. That will be a long-term investment that will continue to be useful even after this pandemic. But on the minus side is that we are not able to reach all learners. No matter how many gadgets we produce, there are infrastructural challenges, and this will introduce yet another socioeconomic barrier to education. We already have barriers to education, and this will just be an additional one. Can we innovate? For instance, based on our philosophy of education, are we able to change the syllabus to accommodate schooling in shifts? This means we invest in more teachers, both teachers and their training. Are we able to open air classrooms in the absence of I'm sorry, there's a bit of interruption.
Sorry, Prof. Could you please mute your microphones and turn off your cameras kindly?
Okay, I think that is done. So as I was saying, then we already have many. I mean, we're looking at open air classrooms as another way of innovating. But then obviously we would worry about the elements. Too much sun, too much cold, too much rain would interfere with that. Are we able to overhaul the curriculum, change its orientation to reflect a post-COVID-19 reality? That is the other question. I don't know, because that depends on the philosophy of our education system. The other 8 things that must be considered, and I heard the Cabinet Secretary talk about this yesterday, is the possibility of mass masking. And then as we talk about mass masking for our children, what will be the lower age limit? What is the efficacy of masking in children below a certain age? So this we do not know, and we have to discuss that. Constant use of sanitizer, soap, and water. The expense, who will bear the expense? Are we ready to do this and do this for the long haul, or is this something that we will start and then stop midway? And therefore, what's the long-term outlook? As I conclude, the long-term outlook, I'm sorry to say, is not nice. Without a vaccine or a cure, everybody will eventually be exposed. The probability of exposure is extremely high if we do not get a vaccine or a cure. But we hope that any infection a person gets confers relatively long-term immunity that will then mean that then their risk of getting another infection is significantly reduced. Now, if we keep the daily infection rates low, our health system will remain functional and those requiring intensive care will have a fighting chance. But if the numbers surge beyond our ability to handle them, for whatever reason, large numbers of Kenyans will die from COVID-19 related complications, and an even larger number will die of unrelated preventable causes due to impeded access to care. It is my opinion that sending our children to schools without considering these risks is reckless and inhuman. And so any consideration to sending our children back to school must take these factors into consideration. And with that, I want to thank you very much for listening to me, and I'm happy to take any questions after this.
All right, thank you so much, Prof, for that very insightful and interesting presentation that you have just made. And one thing I am noting is you're very much interested in recommending for mass testing, because we're not having you on our panel for the first time, and in even the previous panels before even we started considering when COVID-19 was a new thing, you had highly recommended for mass testing, and it's here catching up with us. And we've also had discussions, and our focus has been safety in the schools, which is very key. So before we have our children back, we need to be assured that the schools are safe, and it would be a good idea to have. And now you're bringing in the element of the new innovations, and now we have to also look at the challenges that will come with the innovations. And Kwame will be coming in as our next presenter, and he will be definitely giving us these numbers and speaking more into those innovations. So Kwame, you have 15 minutes.
Okay. Thank you very much, and thanks to Dr. Lukoe and Dr. Riechi, who've, I think, laid the ground. So in terms of outline, I just talk about what are the factors that determine risk to COVID exposure. This is basically, these are clinical facts, so it's not really economics. What then are the risks that come from that in terms of reopening schools? And I think the student population and infrastructure is a critical issue. I think the previous speakers have spoken about that as well. We think testing of teachers, and then we'll talk about what the emerging issues and things that remain should be. So coming to the main presentation, I think we wanted to find out what kind of a school environment is an environment in which, or rather, as it is in Kenya, most learning takes place at all schooling levels, whether tertiary, basic education, which is both primary school and high school, takes place in a classroom, where there's a teacher who's responsible for leading the learning, and of course, they're the learners who respond. So it's a very highly interactive and physically interactive session. So we asked ourselves, what are some of those factors that determine risk to COVID exposure? And we looked at a publication this year by Peel and Barn Murdoch, 2020. This publication was reviewed in the Financial Times about a couple of weeks back. So if you look at it, you'll find. And they say that all the things that we know so far about COVID-19 exposure, there are three factors that are most significant. One of those is the proximity of people, proximity to people. So a victim in terms of proximity to people would allow for exposure, the duration of that exposure on the one side. So basically, it's not just that you have passed around somebody, but you've stayed around a place, because this is a droplet infection. And then the degree of confinement. Now, degree of confinement talks about the density or the school, or I mean, the density or the space that's available. If you look at schools, most schools, and we'll show numbers in a while, most schools have lots of children or lots of learners. So proximity is definitely qualified. The duration, obviously, because class time at the primary and high school level, children in class for about 7 hours to 8 hours every day. 6.5 to 7 hours every day. So obviously the duration of exposure is also high in as much as there are breaks, but the duration of exposure of your learners within the classroom or in the learning environment exists. And then the other is the degree of confinement. Many of them do not necessarily sit in the outside classes. They tend to be in classes or what we call classes. There's a huge variation or diversity in what qualifies as a class in Kenya, and there are much bigger differences about what classes are. But in general, children are in some kind of confined place in the form of a container of some sort. So if you look at all these things, it tells you that all these factors that determine risks to COVID-19 exposure exists in learning environments in schools as they're delivered today. So I'm talking about schools pre-COVID, where most learning was teacher-guided and physical proximity was necessary. As we go next, we then ask ourselves, what are the risks in reopening schools? And I think the government itself has also defined schools, or rather mass gatherings, as any event with more than 10 people. So obviously, if you're talking about a school or a class size, and our average class size we'll see is upwards of 40. If you're looking at that, obviously, then it's in the form of a mass gathering. I mean, children are expected to talk back, teachers are guiding learning, and students are speaking to each other as well. So if you take the very basic analysis or the very basic definition that government has taken in terms of number, in terms of mass gatherings, I think a school would qualify as that today. If you look at the boarding school scenario, and we're talking here of high school, and Kenyan parents tend to have a preference or a demand for boarding schools and confined schools, they're very, very confined spaces. In fact, some schools, contrary to what government should allow, do not even allow parents to look at the conditions under which students are placed. Why? Because the intake and enrollment is very high, and in many, many cases, students sleep in very highly dense places. So we have triple deckers in some schools, as has been reported. Obviously, it varies as much. If it's a non-residential school, then obviously the circumstances are different. But boarding schools have high demand at high school point, and this covers almost between 4.3 million children, in addition to travel. If you talk about the day school scenario, again, Professor Lukai mentioned the dynamics of the spread and as people interact within schooling environments in terms of students have to either travel across what we call, across county lines, across neighborhoods. So even for day schools, there'll be risk of spreading, and the school environment is particularly rich. I think most kids get colds in school, bring them back home and transfer them back the other way. Given the ease of spread of the virus as we know, it's clear that this day school scenario would also be one in which people go back home. People are thinking about boarding schools, and I think some of the examples some of the proposals that have been presented to the task force that's considering school opening is that once students go into boarding schools, then there should be like some kind of localized lockdown, in the sense that schools do not allow interaction. Of course, that's a bit naive, even as those who say that, because schools have a lot of people interacting, whether it's suppliers, whether it's people who come in on a day by day. So it's not only the students at their confinement that would present. But on the whole, I think these risks are quite salient. So if we've considered the risks, if we've considered the circumstances under which COVID spreads, so let's look now to what does this mean in terms of the student population and infrastructure. Our view is that student population and infrastructure in schools actually knocks back quite substantially and reminds the entire Republic and Kenyans about what the state of the schooling environment is, even before COVID itself and the lethality of this pathogen. So if you look at the levels of pre-primary schools, there are 46,000 pre-primary schools. The number of learners is 2.7. So the average number of learners is about 58, but there's a huge variation as well in terms of those pre-primary. However, you'll understand that most pre-primary schools actually have a smaller population than primary schools. So primary schools and secondary schools is where we have the crunch. We have 32,000 primary, 344 primary schools, 10.1 million learners, coming down to about 312 learners per school. Again, this depends on the number of, on the size, on the class size. Some classes vary as well in terms of size and all that. And then at secondary school, it's about 315 student average number of learners. So if you look at this, what it tells you is school sizes vary, but on the whole, it tells you something about the fact that you'll be dealing with quite some variation, not only the variation, but you'll be dealing with a huge population which teachers and the management have to. So the first thing this tells you is about the population, student population, and the infrastructure that's available in schools. And it's not available. Professor Lukai has mentioned some of the things that would be completely necessary in order for us to have confidence that the school environment would be equivalent. The school environment would be comfortable for kids. So these are the numbers that we're dealing with: 315 and in one case 312, and starting from 58. So on the whole, we have the numbers that we have are basically not trivial. So if we consider the numbers and we're looking at the situation in schools, one of the things you then ask ourselves is, okay, if these are the situation, if this is the situation and these are the number of schools that we have, as we go to the next slide, what we need to find out is then, can we go to the next slide? Winnie, can you take me to the next slide, please? Okay, yes. So the first thing we need to ask ourselves is, so we've talked about the student side, let's talk about the teacher side. Now, the teachers, so we have the teachers and they're younger. And the epidemiological evidence, some of the publications, Lancet and others have shown that, look, the risk of children passing school, I mean, or rather, let me start with this. 100 in the world today, 107 countries imposed a school closure, in the sense that they closed schools as they tried to flatten the curve and to make sure that systems were prepared for any surge. Some models have led to some models that epidemiological models have led to estimation of what allowing kids to be in school, how much allowing kids to be in school would raise the mortality rates. And they suggest, of course, it's very early, that closing schools would actually save about 4% of the fatalities. Because as Professor Lukoy stated, irrespective of what happens over time, if we do not find a vaccine or a cure, then over time, the virus will spread. It's just a matter of time. The virus will spread, and over time, a huge number of the population, if not everybody, would actually have it. So basically what then it shows, the advantage is for younger kids or younger people at the demographic, the infection with the virus is does not impose as high a mortality rate as it does for older people. However, if you look at the age groups in terms of the teachers, the teaching service in Kenya is just between the ages of actually just slightly mid-20s all the way to about 50 to 55, or 60 at the tops. Now, if you look at the mortality rates for 20 to 49, the mortality rate globally is about 1 in 1,000. So it tells you that if an infection occurs, only 1 in 1,000 of people between the age of 20 to 49 would be infected. Only 1 in 1,000 of the people who are infected in the age group 20 to 49 would die. Of course, it depends on the competency of the health system to begin with, but on the whole, this is your best case. Tested in Europe, tested in the Far East, and has also been tested in the US. And then 50 to 64, it now comes back to 1 in 100. And of course, above 65, there are no teachers above 65, but there's interaction with people who are above 65, whether through schools or whether some parents and all that. It comes to 6%. Now, what this table tells you and the red lines tell you, this is what the risk level might be for teachers. So our view is that the testing for teachers, on the whole, even if we accept that for students there'll be less risk, becomes extremely important. And it re-emphasizes one thing that the speakers who spoke before me spoke about. We really need to know what the numbers are here as we discuss what approaches to take before schools are opened in many ways. And I distinguish between learning happening and schools being open. Learning ought to go on, but opening of schools is something that needs very, very broad considerations. And this number advises us that you might have to actually start to test teachers to make sure that, one, you cover for their lives, definitely, because you do not want to expose them to infection from kids or from their pupils who would not be as much at risk, because many of them would be what clinicians called asymptomatic carriers. So basically people who are infected, but they would not suffer the disease, but that doesn't mean that they can't pass it to other people. So because of the intensity of interaction, physical interaction within classrooms, we'd have to take account of what does it mean to test teachers to make sure that at all times, those who are unwell or those who are infected are both aware of the risk, but more importantly, both aware of the risk, but also more importantly, have systems in place to actually help teachers. Because if you know, the Republic has 330,000 teachers throughout the spectrum of all teaching professionals. So let's go to the next slide. If you look at, taking all these factors into account, what are some of these emerging issues? I think I think this question about data and disclosures has been beaten almost to death, but it's something that we need to re-emphasize to the Ministry of Education on one side and the Ministry of Health particularly. If we do not have disclosures about what the epidemiological model that is used to determine the response, what is the transmission rates among children? Fine, it's shown to be very low in some parts of the world, in most parts of the world, but to the extent that we know that in Kenya and in Africa generally, some parts of Africa, the trajectory of the disease has been very, very different from what happened in Europe and even in the Far East. We need to ask ourselves, what are the peculiar forms of behavior of this illness or this infection in our environment? And more importantly, what's the risk level according to a model for those between the ages of 4 and 19? Now, this is essential so that we can alert parents, and part of this would require disclosures and discussions about what the risks really are, so that all people and guardians who allow kids to go to school and teachers are also aware about what kind of school level preparation is required. Transmission rates among children, one child to the other, what are the risks that this takes for all that? So that's the first one. The second is basically, we think that it's overdue to have graduated alerts. And now graduated alerts are basically a form of either color-coded or numbers, which tells you what the safety levels are in every single, say, county or every geographical area. And the point about this is this would have to be imposed by government or designed by government, because these graduated alerts are essential to telling us what needs to be pulled back or what needs to continue. So for instance, I think an amusing picture has been shown in Kenya on social media, showing when kids went back to school in Hunan in China. And about Wuhan in China, and one of the things that you see is kids coming up, teachers are prepared, teachers come, receive the kids, give them a dollop of sanitizer in their hands, ask them to wash, to rub their hands together, then they pass through a screening system, and their temperature is taken and stuff like that. Now that has happened because it allows for graduated alerts to tell you that when the alert is, say, green, this is the acceptable behavior. When it gets to this level, government may have to impose far stricter measures and all those things, because those graduated alerts then inform behavioral changes on the part of the population. So I guess that's something that's long overdue. And whether we are opening schools tomorrow or next year or September, I think this form of alerts are necessary nevertheless. The final one is, the other one is mass testing. I think we need mass testing for reasons that have been stated, so I will not state it anymore. But the thing that is completely evident to me is that mass testing is something government needs to get. And the excuse 3 months after all this started, that global supply lines are congested or global supply lines have been disrupted, and for that reason Kenya is unable to get it, is now becoming more and more of an excuse, in addition to the very shameful thing that we had, which was that donations made to the Republic, not to an individual, donations made to the Republic actually disappeared. Tells you that there is an absence of seriousness about a public health issue, which all medical professionals describe as a kind of danger that a society faces one in a century. So obviously, it's clear that for all the best intentions of the Ministry of Health, they're giving us a suboptimal performance. One other thing that we worry about is it's very, very clear if you take all these issues together, that while the world wishes that a vaccine could be found, I think the best outcome would be a vaccine or some kind of treatment, and then that it would be completely possible to actually scale it up very, very quickly, so that to the extent that is possible, everybody goes back to the situation pre-March this year. It's clear that the testing that's required to ensure that a vaccine is safe and its mass production is still at the least about 6 months to a year away. Some people say even 2 years. What that means is that what we have right now in terms of the behavioral changes that are required and the safety measures in terms of physical distancing are going to remain with us for a long time. And what it tells us is this has significant implication for school sizes and class sizes. So our view, economics tells us that school size is different from class size. A school size could be big. As we know, there's a school in Kisumu, 5 kilometers from the CBD. 3,000 students, 70 teachers. School size is big. Class sizes would definitely need to be altered because I think under these conditions and the possibility, as we've seen even in Korea, which had managed to flatten the curve, this disease comes back in cycles. It comes back in cycles, even if later cycles are less lethal, and let's hope that retains it retains that character. But class sizes need to move. So if you have schools that have 80 kids in a class, I think we need to know what we are playing around with at that time. So what that tells us is what kind of investment government will be making in terms of ensuring first that we have standard and safe classrooms to begin with for every public school, and regulation for all private schools to make sure that that's a standard that's acceptable. And the final point is that the biggest thing is that government is required, in our view, not only to speak with one voice as they do, to actually tell the truth and show confidence, because we have a subterranean, not only in Africa, but in other parts of the world, conspiracy theories around vaccination. And I think here, the voices of professionals such as Dr. Lukoye and people who've actually studied and know the benefits of vaccination as both a private and a public good, and the public goods because if one person is less, if one person is vaccinated, it protects many more people. I think that's a voice that needs to come in, and the idea here is for governments to actually get the public to have more confidence in vaccines and vaccination, and what it would mean as some countries over the world are passing laws. I don't think they're always necessary. Persuasion is possible, where parents are reluctant to have children who are not vaccinated sit in class with their kids. So we'll see some of these discussions coming out here as part of public health policy. Thank you very much.
All right, thank you very much, Kwame, for that presentation and for now breaking down and giving us the numbers that we are looking at, as even as we're considering reopening of schools. And one thing that comes out very clearly is that the first thing we have to consider as we advocate for the schools reopening is safety first. We have to ensure that the environment that our children are going back to is actually acceptable and within the health recommendations for them to go back. And this is not just a consideration for schools, because we have children who will go back home. So as we're ensuring that schools are safe, we also have to ensure that the households they are going back to are also very safe. And back to school, the infrastructure, we've had a conversation about the infrastructures and the examples that have been given about the school in Kisumu, where if they're supposed to ensure that they only have 20 learners per class in line with the social distancing 1 meter rule that we have, then they only have 45 schools. So they need an extra 105 schools, 105 classrooms to ensure that the social distancing is observed. So I think our presenters have really broken down the conversation for us, and I can see we've already started having questions and comments on the chat. And so please remember, we are now moving to the Q&A session, and you can please type in your question or comments on the chat, and we will have them responded to. So for the Q&A, I will be inviting my colleague John, who will be taking us through the session for the next 30 minutes. So we'll try to have all your questions responded to by the panelists within the next 30 minutes. So John.
Thanks a lot, Winnie. My name is John Mutua. I work as a programs coordinator at the Institute of Economic Affairs. I think Winnie has ably summarized the discussions from the three panelists, Dr. Riechi, Dr. Lukoye, and our CEO, Kwame Owino. And you can already see the connection, so I'll not get into that. So mine is a simple task. I would like to invite you, participants, to ask whatever question or make whatever comment that you may have. And I know that already in the chat box we have I've seen a couple of questions. And so again, this is just to encourage you to use this. But feel free to raise your hand. I can see, let's see. Raise your hand. So there's Ronald, please, Ronald. You can unmute and pose your question before I go into the chat box. Ronald? Okay, I guess, let me see. So let me just read, I'll go through, thanks a lot to the three panelists. So I'll go straight to the questions that have been posed, and I'll read them as they are stated. So we have the first one from Aloyo, and some I know, some have been directed to the panelists, and some of the questions are general. So, so let's see. So at least, so from Aloyo, I'm a Teshe. So what I don't know if it's a lady or a gentleman, but anyway, what they say is that reopening of schools is not a problem. My concern is the fact that many public institutions are overpopulated. This therefore goes against the health and safety regulations to reduce the effects of the pandemic. So what strategies are in place to cater for this challenge? I know the three panelists actually alluded to this, and so this is actually open, just maybe to rehash what, and especially from this actually, Dr. Riech, you can weigh in on this. What strategies are in place to cater for this pandemic, for this challenge, as well as Dr. Lukoye, you can touch on this. Let's see.
Can I respond quickly?
No, let me just read through so that each of you can note the questions that have been posed. And of course, yeah, Dr. Riech will start with you. Just 1 minute. Then from Joanne, so our comment and question is related to the issue on equality raised by Dr. Riech. This is another one again to you, Dr. Riech. The Constitution speaks to establishment of an equalization fund for purposes of bringing up to par regions in this country that may have been one way or another left behind in development. Has anyone undertaken a study on the impact of that fund, noting the Constitution is 10 years old? So Riech, you can note that. Then I guess this is to Kwame. So there's somebody from CGIAR. So they would like you to cite or to share the citation or link for the reference of the Peel and Ban Modoc 2020 on risk factors to COVID-19 exposure. So I think you mentioned some study that you referred to. So so they would like you to share the citation and link to that. Then there's another one. I'm not sure who shared this. Oh, sorry, I think it's the same person. Given that we cannot de-risk, this is again open to the three of you panelists. Given that we cannot de-risk uncertainty, what is the way forward? We know that in terms of e-learning, infrastructure, and internet connectivity, we are still at the infancy stage. There is still a large student population that will not be serviced. What options are there for this population? So again, maybe Kwame and Dr. Riech, you can weigh in on that. So these the last two questions that I note from the chat. So from Honor, it is evident that there has been improvement in capacity of healthcare facilities, especially the main facilities. Could Dr. Lukoye indicate how and when we could attain an optimal capacity in our health institutions that then open schools? So Lukoye, you can note that, Dr. Lukoye. And then lastly, what capacity exists at county level to collect and analyze data to inform the graduated alerts that Kwame talked about? So of course, Kwame, that's to you. So I believe the three of you, the three panelists, you've noted the three questions that have been, the various questions that have been posed. So we'll start with just in the same order of the presentation. So we'll start with Dr. Riechi, then move on to Dr. Lukoye, and then Kwame. You can respond to those that are to the questions that have been posed to you, and any of those that that you feel you may want to weigh in on. Over to you, Dr. Riechi.
Thank you, my former colleague at IPA, John Mutua, and colleagues and participants. Now, I wish to make some comments first to Martin Aloyo Amateshe, whom I know quite well from Kenyatta University. When he was growing up, overpopulated schools, what is being done, that I think is part of the quantitative data that we need collected so that we can be sure of what policy decisions are to be made on how schools are going to be reopened and what needs to be done. So nobody knows. It's a big, big, big challenge. Nobody knows exactly what it is, and we need information. Somebody was wondering what is the situation on inequalities. And I spent a bit of time explaining the genesis of the inequalities and the fact that there is an equalization fund. The question is, what is the state of affairs of those regions that were left behind? We are talking about the arid and semi-arid lands, counties in those, including Turkana, Wajir, and so on. Now, I don't think the situation has changed much. Of course, there's an improvement in some parameters, but I think the question you're asking, do we have any comprehensive research data that that can show the impact of equalization fund? I don't know of any, and I think that is that could be a research agenda for the Kenya National Bureau of Statistics, as well as even the Institute of Economic Affairs. And I wish the Institute of Policy Analysis and Research, IPA, where I worked for 5 years, was still healthy and alive. So this is something I think which graduate students perhaps in our universities could undertake. But it's a good question because like one of the, in 2009 National Population Census report indicated that only 18% of citizens in Turkana County had any education. So I don't know how the situation has changed, and I'm anxious to know, and I would be happy to, to really understand what's happening. Then the general question about there are risks, what, in schools, what are the options? I think those are concerns that must be taken collaboratively, not necessarily the government alone, but by stakeholders, development partners. There are many organizations that are working on the ground. And this is the time, what I've been proposing to the Ministry of Education, to have a desk for coordinating research findings by many actors in the education sector who are in the field, so that we can read the reports. I believe there are many reports and recommendations, many from UN bodies, UNESCO and UNICEF, and I would urge all stakeholders to read what I said, the framework for reopening schools. I'm sure it's available online. What the UN and the Education Coalition, Global Education Coalition bodies have proposed. It's a comprehensive report, but at the moment I couldn't really want, without evidence, I would not tell what exactly are the immediate options. And I think that's what I can say. Thank you, John.
Thanks a lot, Dr. Riechi. So I'd like to invite Dr. Lukoye.
Yeah, thank you. Thank you very much, John, for this. I think there are a couple of things that I should handle. And one of them was a question about, based on everything that's going on, what is the way forward, and based on what we know. And I think in my presentation, I gave a couple of scenarios that whoever is making a decision about whether to reopen schools must take into consideration. And based on the risk tolerance, then a decision can be made. And this is a political decision. The scientists can tell you the outcomes of those decisions, but somebody else must take the political responsibility for them. And one of them, because we have said we are not ready at the moment, and we are unlikely to be ready to have an ideal situation where children can actually go to school and be safe. This is established, I think, even if you look at government data, if you look at the data that we have, and so on. And so a decision that needs to be made is, how much are we willing to risk? If we are willing to risk a lot, then we can open even today, even tomorrow, but try and put in as many mitigation measures as we can under the circumstances, washing hands, sanitizer, trying to space them, whatever it is that we can do reasonably. But then we must be prepared for an upsurge in numbers, and we must be prepared for a larger number of people with severe illness who will require care in our health system that is still hobbled by limited human resource, limited equipment, and so on and so forth. So those are the consequences of the decision. If we are not ready for that, then I would say that we shouldn't reopen schools until we feel we can handle either the surge in cases or the situation in schools. So that's a decision that the people in the committee advising the Minister for Education and the Minister himself have to really think about this and agree on what they are able to take responsibility for and what they're not able to take responsibility for. And then parents will also have to make their own decisions about their risk tolerance when they're sending their children back to school. As far as the optimal capacity in health facilities and when I think it will be reached, the candid answer is that I do not know, because even before the COVID-19 pandemic arrived here, we've been complaining for a long time about the limited capacity of our health system to address our usual health problems. We have, everybody agrees our health, our human resources for health is limited, is very low. And those that are employed, the distribution is very poor. There are people who do not have access to the same quality of healthcare as others in more better endowed areas. So that has been a problem. And now COVID-19 is imposing an even greater burden on this battered health system. And I'm not seeing a seriously concerted effort to build the capacity of this health system to be able to handle both COVID-19, but also the usual health problem that will continue even after COVID-19. In my view, I'm only able to assess our ability to handle things and reopen schools if I see, recruitment across the country of needed health workers. If I see clear attempts at opening up the supply chain so that we can get emergency supplies as quickly as possible. If we see more, focused governance on the health sector, then we can start talking about the system preparing itself to handle surges. As we sit right now, it is impossible to tell, because even our usual health problems in the country, we have cholera outbreak at the moment in some parts of the country. We have outbreaks of other infectious diseases. We have health complications related to flooding. All those are stretching the health system that already existed and that was already in tatters. So it is difficult to tell, but we can only do the best that we can under the circumstances. Thanks.
Thanks a lot, Dr. Lukoye, for those insights. So let's move on to Kwame.
Okay, thanks, John, and thanks to for the questions. I think the first question was a citation from a citation that we that on the PowerPoint presentation, and I've sent the link to Lore Tezira, so it's available for anybody who would like to. They are covering a paper, or rather, it's a popular. The paper was referred to the article was referred to in an article in the Financial Times 2 weeks ago, the Financial Times magazine newspaper 2 weeks ago. But it's available, so I've put it up there. Whoever wants to can look at it. They provided that synthesis of what the factors that determine risk to COVID-19 exposure, which is proximity to people, duration of exposure, and degree of confinement, and they explain it quite well. I think that should be like required reading for anybody who would like to understand this. The second point is about, I think it comes from Tezira as well. She's asking about the graduated alerts and asking whether the capacity at county level to administer them exists. Well, I think, I don't know, epidemiologists would advise us, but my view about it is that 2 months ago, the Institute of Economic Affairs published a paper in which we are discussing the risks, or rather in which we assessed the risks and population level risks and the health system's capacity by county governments. And then we put together a framework that allows you to actually see where the risks are and what kind of capacity exists. And it told us some very interesting things, some of which were confirmed when the president spoke about weaknesses in terms of bed capacity, but also other health systems capacity in counties, including CI and a few others. And of course, you also saw it trend as people were discussing, but the truth is they did not realize that actually those systems are actually very weak everywhere, and they needed to. So that's why when Professor Lukoya Atwoli says that he's very concerned that we bought some time, but we're not using that time to strengthen the health system's capacity, he's actually saying the right thing, and that's one of the things. So one of the things that I would think, and I think this has happened everywhere, is to have surveillance teams at county level, prepare every county to be able to have surveillance teams, which allows for aggregating that data so that data can be brought together to give us a global picture. Because that it exists right now, as he said, first, the testing capacity is low. And then the second problem that we have is that the testing results come after a very long time. So it doesn't allow you to actually have a real-time picture. And so the dashboard that the Ministry of Health is using is a dashboard that does not reflect real-time reality, but probably 2 days or 3 days later. And as you all know, so for instance, let me tell you why 2 days for an epidemic like this, a pandemic like this is a lot. So New York, which had the highest deaths in the US, and the governor was advised today that if you had taken the decision to lock down 2 days later, the number of people who would have died would not have been 8,000, but 16,000. So basically, what this tells you about this disease is the scientists who study it understand enough, not all, but they understand enough to be able to actually guide you sensibly about what decisions to make. But if our testing is first low, and then it comes 2 days later, it means that our ability to also forestall deaths is actually being compromised by our inability to actually prioritize what are the actions that are required. So if we prioritize what actions are required, that's possible. So it's possible to actually establish. And if this requires hiring more professionals, and these professionals can actually come back and give us hiring professionals whose work is just to do that surveillance for as long as this is required, spending public money, that it would be public money well spent, and it actually would be helping to manage the disease at county level, from which then you'd be able to aggregate data and provide alerts at the national level and alerts for every county, because that's how health services are managed and provided. So that's definitely possible. I think there's another question here that maybe Professor Lukoya should answer, but I saw it, someone was asking about the safety of vaccines and what happened with vaccines in Busia when kids were hurt when a vaccine was wrongly administered. Thanks.
Yeah, thank you very much, Kwame, for that. I think there's a lot of information out there and a lot of stories and a lot of misinformation around vaccines across the world. I think vaccinology is a very simple idea. The idea is that there is an observation that many people who get an infectious disease develop immunity against it. So once they fight it off, then they retain memory for that condition. And when it comes back again, they are more prepared to deal with it, and they prevent it from reaching the organs where it could cause a lot of damage. This is by way of things that we call antibodies. So antibodies are like, they are small protein molecules that then take the shape of the things that are on the surface of an infectious agent. There are a lot of things that hang on the surfaces of viruses and on the surface of bacteria, and antibodies then take the shape of those things and identify them. So when one of them has entered the body, this antibody identifies it and then drags it into a cell, which then kills it or immobilizes it. So the idea of a vaccine is to find a person who has not been exposed to that condition and give them something that looks like that infectious agent, but itself is not infectious. And then the body, using that thing that has come in, creates antibodies that then stand ready to deal with the real infection when it does come. So by the time the real infection comes, the body behaves as if it has already met this infection before and eliminates it or immobilizes it. So by the time people are being given these particles that resemble a bacteria or a virus, there have been numerous tests, and the tests begin by looking at people who actually get the infection and seeing if they actually develop immunity. In other words, if they actually develop the capacity to fight off this infection, and then if they retain memory of that infection in their blood cells, that then enables them to fight it off more easily if it came. And if they find that many people who get infected get long-term protection by virtue of that immunity, then the next step is to identify which areas of this infectious agent are most consistent. In other words, each and every member of the family of those infectious agents have that particular component on their body. And once they find that, then they see if that component stimulates the immune system, so that consistently stimulates the immune system, so that every time this particle comes, it is identified and eliminated. And once they find that, then they will test its safety in animals, they will test its safety in the lab, and then they will test its safety in a small group of human volunteers who will then be given a small dose of it to see if they have any adverse reactions or not. After all this has been done, then they will test whether it is effective in people in the population. And again, these people would be volunteers who will be given the vaccination, and then they go about their lives as usual. And if they're exposed to this agent, we will then check whether they're able to fight it off easily. And once that is demonstrated, then we would say we have a vaccine and people can actually start receiving it out there. So by the time any product is injected into a human or given to a human being, it has to go through so many stages of testing, and most of them are focused on ensuring, first, they are safe, and second, they work. And if any of those is violated, then the study is stopped, and those, and most clinical trials actually end in failure. Most new drugs that are tested end in failure before they even reach humans. Most vaccine trials end in failure before they even reach humans. So we, as doctors, when we see a vaccine that has gone through that process and we have looked at the literature and it supports the fact that it is safe and efficacious, we will then get to a point where we prescribe it for the people for whom it is useful. So by the time a doctor is recommending a vaccine, chances are it has gone through those steps and it is safe. What happened in Busia and in other places where we have seen complaints that somebody was vaccinated and then they got sick, is that the route of administration, so sometimes it's an injection, and the person administering the injection might injure a nerve, especially if they are not experienced or if they are not knowledgeable enough. And that's why it is important to recruit the right mix of human resource so that people know what exactly to do. Sometimes vaccines, just like any other medication or food or anything you put in your body, can have a peculiar reaction to some individuals, which cannot be predicted during studies because every human being is different. And there are a few people who respond in the opposite way to things that most people respond in a particular way. And this is taken care of through surveillance. So if a person is given a medication or a vaccine and reacts differently from what is expected, this is logged down, this person is followed up, and everything is done to ensure that they recover and they are well. But this information is then sent back to the regulators, who would then say, can you consider this as another side effect of this vaccine? Is it serious enough for us to stop using it, or can we continue using it but then be cautious in people of a certain complexion or whatever? So there are a lot of processes that go on before we say that a vaccine is working, a vaccine is safe, and a vaccine should be given to people. But there is a lot of misinformation out there, and it's our responsibility to continue looking at that information as it comes in and to counter it with factual information, which is also readily available online. Thank you.
Thanks, Dr. Lukoe, for really also educating us on that and the steps that are required before vaccines are authenticated as safe. Okay, so we'll go to the second and final round of Q&A, and from our chat, I think there maybe just 2 additional questions. So I'll just read them out. One from Ezekiah Otho. So what Ezekiah would like to know is that what he says is that COVID has come with heavy financial burden to the government. Can this burden be co-shared with the parents? What are some of the options available for consideration, and how can this be achieved? So I guess this goes to Dr. Riechi, but any of the 2 panelists can weigh in terms of if they have any additional inputs to that. Then from Honor, so Honor says that it appears we must have primary schools without social distancing, given the nature of the learners at this level. Could Kwame talk about this, about the economics of this? Kwame, I hope this is clear. It appears.
Yes, it is.
Okay. So those are the only 2 questions that I can pick or that I see from the chat box. And so I don't see any additional questions. So what I will do, I will turn it over to our 3 panelists to respond to these questions, and then make their final remarks. So I'll start off with Dr. Riechi, follow the same order, Dr. Lukoe, and then Kwame. Kwame, you can conclude and give your final, your parting shot.
Thank you very much. Thank you, John, and listeners. Cost sharing. I think I have to make it, to be very honest, that much as we have been talking about free primary education, free day secondary education, I think to a large extent, the provision of education in this country, even at the highest level, university level or tertiary level, is funded by both government and households or individuals and families. So I remember many years ago, between 2005 and 2010, when I was a policy analyst at the Institute of Policy Analysis and Research, IPA, we presented our views. I think it was around 2008 regarding what is now called free primary education, and we proposed that we do not call it free, but I think free is political. So what I'm saying is cost sharing has been the order of funding education in this country, with, of course, challenges that cause government, the government and other stakeholders to chip in through what is called demand-side financing, where those who have challenges are supported from some kitties, from some funds, and that's why we have the constituency development fund supporting some learners who are in need. So cost sharing is not something that we can debate about. The CS for Education, a day or so ago, he was saying millions and millions of masks and other personal protective equipments will be required when schools reopen. Now, those are not going, the government is, as I said in my earlier presentation, those and other essential requirements in schools and to keep our children safe cannot adequately be procured by the government. I think so. What I'm saying is cost sharing is going to be the order of the day in financing education, and it's unfortunate because whereas some parents are able to support their learners or their children when schools reopen by providing the personal protective equipments and other measures, there are parents who are struggling with the basics in terms of food, water. Girls are still fetching water several kilometers in those arid and semi-arid lands. And so it's quite unfortunate that some of those may be affected. But yes, cost sharing is going to be continued. Let's not cheat ourselves that we have 3 days secondary education. And as I said earlier, I'm talking because I've been a chairman of a board of a secondary school, a day secondary school out in my county. And I know what parents have to do. They have to pay the lunch and other costs, which we call in economics indirect costs of education. Tuition, the government sends, and sometimes it's delayed, sometimes it's not adequate. So yes, cost sharing is there to stay, unfortunately. Thank you.
Yeah.
Yeah, Dr. Lukoye. Thank you, Riechi, Dr. Riechi.
Yeah, thank you very much for giving me this opportunity to have this engagement today. And I think I'll only make a couple of closing remarks. And with relation to COVID-19 and education, I would say that first, we must accept that this is a long-term thing, and the long-term in Kenyan parlance, of course, is not long-term with everyone else, but long-term, in my view, at the moment, we should be thinking at least 2 years from now, and we should make assumptions based on the fact that this thing might be with us for another couple of years. And having made those assumptions, then we should get all scientific evidence about what needs to be done in that period for us to be able to resume certain functions in our economy. And then having done that, then we should marry that with whatever form or shape our education policy and philosophy is, why we are taking our children to school in the first place. And once we have married those, then we can take rational actions, because many of us are just taking children to school for the sake of taking children to school. Sometimes we're taking children to school just to keep them off the hands of parents. For those in the middle class in this city of Nairobi, some of them, it is an important existential thing that the children go to school and break the cycle of poverty and deprivation and so on and so forth. So thinking about why we take our children to school, marrying it to a 2-year timeline of dealing with COVID-19 will help us then to use evidence to make rational decisions as to where we begin. And that sounds to me like we might start opening, say, health training institutions. We might start thinking about tertiary institutions that are amenable to being opened in that kind before we go down to more elementary schools and thinking about taking children back to classrooms before we put in place health measures. So that's all I can say. And I would say that finally, the final decision sits with the person who takes political responsibility, and our task is to advise on the options and the consequences of those decisions. Thank you very much.
Yeah, thanks a lot, Dr. Lukoye. Kwame?
Okay, there's just one question from Ona about reopening without physical distancing. I think that's true, but I mean, the only way we'd be able to open and to give parents who also have to take responsibility and care for their children is if we think that government systems are sufficiently expanded, or at least are sufficiently prepared so that should anyone become unwell or should any intervention be required, it will be available. If that doesn't happen, then it will be very difficult to get the confidence of parents that you can go home. I know that people have argued, and I think Dr. Riechi mentioned it quite really true. There are also risks that come from people staying at home, or rather school-age children staying at home, coming from the fact that for some of them, schooling actually is a form of subsidizing daycare for parents, because if parents need to work, some parents take their kids to school and they go to work and they pick their kids in the evening because they have nobody to take care of the kids in the day. So it works very well when schools are open. Nevertheless, given the risks that Professor Lukoya Twele has talked about, I mean, I think we cannot sacrifice the lives and of kids, but also the possibility that this is not your regular illness. This is an illness that, as I told you, depending on how far it's gone in the trajectory, 2 days difference in decision making can actually lead to double the number of deaths, and that's really, really expensive. So if daycare is what is required, and if food is what is required, because there are also schools, and we know this even happened in England, where part of closure of schools meant that some kids who depended on a school lunch, on a breakfast, were not able to, then what we need to do is we need to plan to provide vulnerable communities, vulnerable households. And they're known because we have sufficient data from the last census, but also from the welfare surveys that have been undertaken. So we know which are the most vulnerable people to the household. It is known. And if that is necessary, then it's government's responsibility to marshal the resources and make sure that that is provided so that that happens. But opening schools just because the opportunity cost is that daycare services are not available, or working parents are unable to go to work, or that some kids can't have food because they're poorer, means actually we need to find a different way to satisfy that need, as opposed to making the disease spread. And then Hezekiah asked a question that which Dr. Riechi has answered, but I'll go back to it again. Look, in the study of economics, you learn that there are some things that are called private goods, and there are things that are called public goods. And public health is a public good in the sense that one person's being healthy, especially for control of infectious diseases, is a public good. So all the problems that come with the need to control infectious diseases largely will have to be borne by resources from government. So if government needs to keep schools, or it needs to get more teachers for whatever reason, or it needs to redesign a system that ensures that learning takes place outside the conventional classroom, that is a cost. That's the reason government exists. And those are the things that government does more efficiently than other people. So we will not. I'm reluctant to release government from this function, because that's precisely the reason it exists. It is an onerous task, but that's again the reason why families cannot do them on their own. Government can do that coordination function and make sure that all these things are provided. So yes, if the burdens are real, and public education has a component which has positive externalities, and government needs to come in as much as it's possible. It's necessary, as Dr. Riechi said, and resources are scarce, so definitely parents will have to pitch in as well. But on the whole, managing pandemics, epidemics, and good public health and their connection to education is the responsibility of government, and government needs to be at the front line. So it cannot be forgiven for that. But on the whole, thank you very much, everyone, for listening to us, and I thank my co-panelists. So I'll pass it back to John. Thank you very much.
Yeah, thanks a lot to our 3 panelists and of course to the participants. But I guess before we wrap this up, I would like to invite Winnie to let us know what the next steps are. Winnie?
All right, John, thank you so much for conducting the Q&A session. And I believe our participants have been very well informed as far as reopening schools is concerned. It's a conversation that has been going on, and we've had a lot of conversations around the education sector, and we hope to continue to have these conversations, even to just keep us abreast with what is happening in the education sector. And just to inform you as well that at the IEA we have been conducting a series of webinars just to have a discussion around COVID-19 and the impact it has had on different sectors. So please be on the lookout on our website and on our social media pages, where we normally post our upcoming activities and upcoming webinars, so that you can always join us and be part of the conversation. So I'd like to say a very big thank you to our panelists for making time to to be here with us and to inform us. And I believe now we are in a better place to make a decision on whether or not to have our children going back to school. And we know where to put the pressure so that we have the right measures in place even before we take our children back to school. So thank you so much, everyone, for making time, and we hope we'll be seeing you next time. And yeah, thank you very much. So yeah, we'll see you soon.
Thank you. Bye-bye.
Would love to.
All right, bye, Prof.
Yeah, so thanks a lot to our panelists and asanteni sana, and of course to our participants. So thanks a lot. As Winnie mentioned, just look out for more of this from our social media pages, and have a good afternoon. Thank you. Bye-bye.
Bye, John.
Bye. Bye, Dr. Riechi. Good to hear from you.
Asante sana. Yeah.
Yes, asante.